Hi everyone. We'll start around 6:03, just to give everyone the chance to join. So we'll start in like 2 minutes. Right, I think we can get started. So welcome everyone, and thank you so much for joining tonight. We're really excited to host this webinar, and thank you so much for expressing interest. We're currently at the 3rd cohort, and tonight our aim is basically to give you some more information on the 2 roles that are on offer and on our training program. So I'll start with showing you the outline for tonight. Can I get next slide, please? Thank you. So we'll just do a quick round of introductions. Clarissa will share you some information about the training program, and I will talk about her role. Amish is here to talk about the cancer screening trainee role. Then we have also our trainees from our 2nd cohort with us who will talk about their experience, and there will be time for Q&A as well. So during the webinar, if you have any questions, you can pop them in the Q&A. So at the bottom of the screen, you will see Q&A. So throughout our webinar, you can pop them in there and we will answer them throughout. And also at the end of the webinar, we will answer some questions too. So we'll start with introducing ourselves. So I'm Sophie, I'm Operations Officer at IJHI, and I run the operations for the training program. So I'll be dealing with you quite a lot. And I'll pass over to Clarissa.
Thank you, Sophie. Hi, everyone. My name is Clarissa, and I'm an Honorary Research Fellow at the Institute of Global Health Innovation. And I no longer work at IJHI. I now work at NICE, but while I was at IJHI about 2 years ago, I proposed and founded this training program. So it's my pleasure to still be involved to meet you all and talk to you all this evening. I will now pass over to Kaede.
Hello, I am Kaede, like Clarissa mentioned, and I am the digital health trainee here, doing more specifically on the cybersecurity works. I think I'll pass it on to Deborah.
Thank you. Hello, everyone. My name is Deborah. I'm the mental health trainee. I've been working with Climate Cares on climate change and mental health, and I'll pass on to Angel.
Hi, I'm Angel. I'm the breast cancer trainee working on breast screening in South Asian communities. Welcome to the webinar. I'll pass it on to Amish.
Hi, I'm a surgeon and research fellow at the IJHI, and I'm here to talk to you today about our cancer screening role. and I'll pass you on to Eleni.
Hi everyone, I'm Eleni. I'm the Centre Manager for the Patient Safety Translational Research Centre at Imperial, and I'll be speaking with Anna on the Patient Safety Trainee role, so I will pass on to Anna.
Thank you, Eleni. Good afternoon, everyone. My name is Anna. I'm the Associate Director of the Patient Safety Translational Research Center, and I'm also an Advanced Research Fellow working on digital health and patient safety, and I work alongside Eleni. So I will pass to, I'm just checking who's Deborah. So
I think we've had everyone.
yes, I think we did. Thank you. Thank you.
We also have Misha. Misha, you will not see because she's sharing her screen, so she's hidden her video. But she's a fabulous member of our team, and she's working on comms and events at IGHI, and she's being a massive help towards the training program as well. So she's with us too. And then I think we can get started, and Clarissa will tell you a bit about the training program.
Thank you, Sophie. So it's quite nice to kind of take it back to where the need for this training program arose. So it was about 2 years ago that the world was in a state of flux, and we were really reflecting on how it was impacting people who are entering the work market, and especially trying to get roles in academia. And what we realized was that there are a lot of paid work experience opportunities that are aimed at early career professionals that still require years of experience. But the nuanced challenge we face in academia is that still across roles, we have a lot of underrepresentation of people from certain groups. So as we'll show you just now, and we're talking about people from Black, Asian, and ethnic minority backgrounds. Misha, if you wouldn't mind pressing the next, thank you. People from LGBTQ plus identities, and people who live with a physical and mental disability. So recognizing what the challenges were, it was kind of an interesting reflection on where we were as an institute and what we could do to support those areas. So at the institute, we kind of recognize that we are a very diverse team, both in terms of our professional backgrounds as well as our lived experience. And we could also work with teams like an HR and the Equality, Diversity and Inclusion Centre to offer a standardized recruitment process and training opportunity for early career professionals. So with that in mind, we created the Julia Anderson training program, just to give you some overview of what that is. It's a paid work experience program specifically aimed at people who have no or limited prior work experience in the kind of work that we do at IGHI, and we'll talk a bit more about that later on. And what we aim to do is to bring on trainees to support really meaningful pieces of work that we're doing at IGHI. And through that, they'll gain really good experience and hands-on experience and skills that they can use to kickstart their career. So this is really for people who are at the very beginning of their career journey. We advertise placements twice a year, and depending on the project, they can last between 8 and 12 weeks. And there's some other benefits to the program as well, like we have a bespoke induction and onboarding process. So when you start, you'll get a very specialist introduction to what it's like to work at IGHI. We also have a mentoring program. As the salaried employee of Imperial College London, you get access to all the online training resources and also internal vacancies that we have. And then once you successfully complete the program, you get a certificate to say thank you and well done. So this program is really special to a lot of people, and you'll hear from the trainees who are currently on the program about what it means to them. But just to reflect on what it means to us, this program has brought us so much joy to meet people who are starting out in their career and to support them and learn from them. But also it's really meaningful to Imperial, and this year we celebrated a win. We were awarded the President's Award for Excellence in Community and Culture in the Equality, Diversity and Inclusion criteria for our work, and that's just a photo of our certificate and some flowers from the day. Thank you. So now to the nitty-gritty, looking at eligibility criteria. So we'll just list off some of the points that are on the website, but hopefully add some more context. So the first one, we are specifically looking for people with limited prior work experience in the following fields: health, science, technology, and business management, because those are the areas that we work in at IJHI. When we talk about limited prior work experience, we're talking about any work that is less than 2 months. So that's what we say in terms of limited. And with that in mind, we're also specifically not looking for anyone who has, or we're looking for people who have never undertaken an internship or training program before that lasted more than 2 months. We also accept people who are age 18 and above. So this is a different criteria to what we initially had. Initially, we were only looking at undergraduate and postgraduate students, but we've opened the criteria up from the second cohort to include anyone aged 18 and above, because we recognise there are some other groups of people that we'd like to reach. So we'd also like to reach school leavers, so anyone who's left, after turning 18 and done something else with their time. We also do welcome undergraduate and postgraduate students up to master's degree level. We don't include PhD students, for example. We also welcome applications from job seekers or those in receipt of universal credit. And we also welcome those who are changing or transitioning from a sector or area of work that's not related to the work that we do at IJHI. Again, just to open this up to everyone who would benefit from the program, we don't have any minimum grade requirements. All we ask is that if you've listed a qualification or a course that you've done in your application, please be prepared to provide evidence that you've actually done that. And ultimately, it's really about whether you meet the requirements of the training post. So sometimes there are situations where you need people with a specific level of knowledge of a certain subject, and that's outlined in the job description and person specification. And then lastly, because this is a fixed term contract that's on a short term basis, we can only offer this opportunity, unfortunately, to people who have the right to work in the UK. It's unfortunately out of our hands to extend the possibility to international folks, for example. So yeah, if you have the right to work in the UK, then great, we can take your application. So bearing in mind, of course, that everyone's circumstances are different, and we want to give people a chance if they feel that they should be considered. We've included a specific section in the About You part of the application form where you can give you can explain basically how you feel like you may not meet the criteria, but why you still feel like you should be considered. Just to clarify as well, that's all that part of the application form is for. So if you meet the criteria, feel free to skip it. But if you feel like you're not confident about that, please use that space to explain right then and there. So talking about some tips for applying, because that's something we get asked quite a lot. So the first thing we advise that you do is review the job description and person specification criteria for the training post that you want to apply to. So what's really important here is that every training opportunity will have different requirements. So if you do want to apply to more than one training post, which you're welcome to do, please make sure that you tailor your application specifically for that piece of work. And in doing so, when you're writing your application, think about all relevant experience to date that you think demonstrates that you meet the person specification criteria. So this could be anything from like caring responsibilities. It could be, odd jobs that you've done in the past that are things like, if you've worked in a shopping centre or if you've worked in a takeaway, by all means call upon that experience. Or if you do any hobbies that you think are relevant, please include that. There's nothing off limits as long as it's relevant to the person specification criteria. And when writing your application, we advise that you use the STAR model to demonstrate how you meet each criteria. So for those of you who don't know, it's an initialism for situation. So talk about the situation that you dealt with. Task, talk about what you specifically did, and emphasis on what you did and not what other people have done or your teammates have done, what you specifically have done. The actions that you took to fulfill that task that you had to do, and importantly, the results. So what came out of the thing that you did, and what did you learn? What are your reflections on that experience that you're speaking to? And to help you prepare overall and give you an idea of, the number of questions you'll be asked, the kinds of questions you'll be asked, the word count of the answer you need to provide, we include a Word document, which is a template of the application form, and it's on the website, and that's what you can use to draft your application. And then you can get someone to check it. You can take it to your careers service in your local vicinity. You can get a friend or a family member to proofread and spell check or grammar check your application. And then once you're happy with it, then you need to upload that to the online application portal. Just to show you on the next slide, where you can find those things. So you can find the application form on the left-hand side of the web page. And we've also got our full frequently asked questions available for you to download and review. Again, do please check that before you reach out to the team, because more often than not, the answer will be in there. So I hope that's helpful. I'll hand over to Sophie now to talk you through the application process.
Yes, thank you so much, Clarissa. So we've added in the timeline. You can also find this on our website, just to indicate that these timings, they can, it's not probably on the exact day, because it depends on how many applications we get, for the shortlisting. Excuse me, for the shortlisting, if you receive a huge number of applications, we might need some time to go through all of them, because we read all the applications. But we will always let you know the outcome, either if you have been successful or not been successful. So as long as you haven't heard from us, it's good news. So you will have the time until the 14th of October to apply. We will aim to shortlist by the 2nd of November, and you'll hear more in the week of the 7th of November. We will then organize a second webinar, very similar to this one, but the head of HR is joining us, and he will basically, this is to give you all the information on your interview, to talk you through, and hopefully to calm your nerves, and to just give you more information how the interviews will look like. And we're aiming to interview between the 21st of November and 2nd of December. And you will find out if you were successful by the 5th. So the beginning of the training post, we are aiming for the 16th of January. Again, this can be like a few days later, depending on how quickly HR can move with the contracts. But this should be the timelines that we will follow. Thank you. Next slide, please. Okay, so I've added in 2 email addresses. So if you have any technical issues with your application or with the form or the website, if it's technical, then please email support.jobs@imperial.ac.uk. But if you have any specific questions about the program or the role on offer or eligibility criteria, etc., then please email me on ijhi.training@imperial.ac.uk. I can't help with technical issues, so please email support.jobs if there are technical issues with the application. Next slide, please. So we have 2 roles that are currently being advertised for the January start. We have the patient safety role and a cancer screening role. And we will start with the, I believe, patient safety one. Next slide. Yes. So I'll hand over to Anna and Eleni.
Hi, everyone. As introduced, I'm Eleni and Centre Manager for the Patient Safety Translational Research Centre, which is a mouthful, so very kindly the acronym to the PSTRC, which is where our patient safety trainee will be placed in the centre. And the aim of the centre is to advance the scientific understanding of patient safety, address safety challenges in healthcare, and translate evidence into practice. So we work across the systems. How can we make transitions between systems between, for example, you attending your GP to your hospital provider? How can we make that safer, but also work at the patient level? So how can we stop, for example, deterioration? Say, for example, in the current COVID-19 pandemic, how can we stop people who are attending hospital getting worse? Can we get them better in time? And stopping things such as long COVID, which is now becoming a much more prominent problem. And our work is a collaboration across both Imperial College London as a university, but also the trust. But we don't just stop there. We work globally as well. We work across academic health science centres, but with other NHS trusts. And most importantly, we work with patients. So we have youth groups that we work with on mental health care, for example, who are collaborating towards their own projects and videos and things like that, which would be incredibly useful for us going forward. If we go to the next slide. So delivery for the PSTRC works on research projects. So we have a lot of amazing research going on. You're going to hear from Anna Louisa Neves coming up, who is working on some amazing research at the moment. We work across research objectives within policy and within the NHS patient safety strategy. And we also host the World Health Organization's Global Patient Safety Collaborative, which is a really exciting project working towards countries strengthen their patient safety leadership and bring in the new future who will help improve safety globally going forward. If you go to the next slide. And we have 6 themes. Again, as I said, work either towards the safety centres or systems across transitions of care or with patients more directly. And this patient safety training will work towards theme 1, which is safety systems across the transition of care. And you'll be working with the very lovely and wonderful Anna, who I'll pass on to now to talk about the project.
Thank you so much, Eleni, and for our ongoing support to the center. So you'll see, whoever takes this role will see the central role that Eleni plays here. I'll give you some more details about the project. So there's a few tasks that we would see as likely tasks as part of this role. These will include contributing and conducting a literature review and collating relevant sources. That would also include having some experience in managing quantitative data and performing the analysis. So again, we wouldn't be expecting you to have any extensive experience on quantitative analysis. You'd be supported by the other members of the team to learn and also to start leading on that part. You'd expect to be part of this research team to not only generate the data, to interpret the results and to generate outputs. And the 2 outputs that we would envisage here would be an academic paper and a blog that would be published in our internal channels and of course in an external journal as well. So the benefits would be the experience of joining a team with experience on digital and patient safety, if it's an area in which you are looking forward to expand your skill set, and to develop research skills, but also transferable skills that you could, of course, use in any other sort of health-related research. I suppose an exciting part of this job is that many of our projects, and certainly the projects that would be involved in this role are projects that have not only local experts but also national international collaborations. So it'd be also an interesting opportunity to expand your network and to work with international organizations. Next slide, please. As I said before, we are not looking for an expert on any of those areas. We are most importantly looking for someone that is willing to learn and is willing to contribute to a diverse multidisciplinary team. And that's a good communicator, not only in what concerns written skills, but not only verbal skills, but also written skills, because obviously this would be important in what concerns the development of the outputs. And I will hand over to Hamish.
Thanks, Anna. So I'm Amish. I'm a research fellow, as I said, at the IJHI, and I work with Gabby, who unfortunately couldn't be here because she's on leave, and I'll talk to you about our cancer screening work. So our cancer screening work is also part of the PSTRC that Eleni mentioned. And what we do is we look at cancer screening, so the different types of cancer screening, and seeing some of the challenges that are faced by women and people who are invited to screening to see if we can overcome them. And we use behavioral science, which is basically a way that we can understand why people don't attend and try and develop new techniques and ways to get people to attend. So we have a number of projects across a number of different areas. So cervical screening, where we're currently working in developing new technology to help GPs improve their booking processes. We've done some stuff in breast cancer screening, where we've developed a new animation which is being rolled out across London to women from different communities to help them address some of the challenges that they face. And we do lots of community type work as well, working with our community groups to understand some of the challenges faced by underserved communities, people who are not necessarily always engaged by the health service, to see if we can kind of overcome the challenges that they face using new and novel techniques. Okay, next slide, please. So as we've got quite a broad area, we look at this role as someone who'd be involved throughout our behavioural team in all these different cancer screening projects. So you'll have a variety of work which you'll be supported in throughout by the team, and that will involve kind of a whole host of different skills, which we hope you enjoy. So that includes things like conducting surveys, doing some data analysis, helping out with things like focus groups and interviews, and actually being involved in design, healthcare design, so actually developing some of the interventions and innovations that we come up with in our projects. So being involved in what's called co-design projects, and you'll be kind of get to see how you could take through that process from kind of inception to all the way to the end of a finished product. So the benefits, as I said, you'll work within our behavioural science team. So it's quite an interesting team which is growing at Imperial and the IGHI. As I said, we have a wide range of activities going on. So there are lots of transferable skills to various other areas. So for example, healthcare design, if you're interested in behavioural science and behavioural research, as well as technology and innovation. We also have a range of partners within the NHS, so NHS England. We have industry partners and charity organisations as well that we work with. And as a part of our team, you'll meet and work with a number of these partners as well, which is a good opportunity to understand what other people in the allied kind of professionals do. And you also have an opportunity to publish your work in publications, which we will support you with and present it as well at conferences. And very much like Anna's project, we are also looking for people who are interested in the field. You don't have to have any experience. I didn't have any experience when I came to this field, but you will be supported throughout anything that you are asked to do or want to do. We want someone who's keen to work in a team, because we do have a team working on a number of these projects, and who is keen to learn. So if you're keen to learn, this is definitely a great project for you as well, because we're definitely keen to teach. Next slide. And I'll pass on to Deborah.
Thank you. Thank you, Amish. So, hello, my name is Deborah, and introduce once again. I'm the mental health trainee, and more specifically, I've been working on the intersection between climate and mental health. An introduction to me. So I'm actually in my first year, going on to my second year of psychology undergraduate, and my general interests are in young people's mental health and also co-production research methods. And that's why I applied to my position. But it really shows that as long as you have an interest in something, no matter what stage you are in your educational career, you can still apply for this role. And I'll pass on to Angel.
Hello, everyone. My name is Angel. So again, I am the breast cancer trainee. My project is to co-design and develop a health intervention with South Asian women, specifically to increase breast screening. A little bit about me. So I did a biology degree at York. I am incredibly interested in embryology, which is why I did this project. I am also a first generation student with a disability, LGBTQ, and obviously BAME. So what I'm trying to say is, please do not be put off to apply, because it's incredibly much friendlier than typical job applications. Kaide?
Yeah, hello. So I am the last trainee of the second cohort. So like I said, I am Kaide, and I am the digital health trainee, doing specifically more on the cybersecurity works. So more about my background. So just from this week, I am a third year psychology student at UCL. I am also an international student. So please don't be scared about, applying just because you're on a student status, or, you have a limited working time for the visa. You may still be able to apply. The reason why my background and what I'm working in is a little bit not aligning is because I started to get very interested in technology field, more specifically on the data analysis. But obviously this was a last minute change. So I had a limited work experience and then I kind of found this traineeship online. So that's why I applied. So my work is mainly on systematic review, more specifically on cybersecurity initiatives that's taken in low and middle income countries' healthcare. I've also done quite a lot of other stuff, recruiting participants for the website visibility testing, writing introduction for the papers, writing briefing notes, making presentation, including this one. I'm doing a lot of administration work that includes emails, or mainly emails. Next slide, please. So you will get a lot of experiences and a lot of benefits out of this. So we think you're obviously going to get hands-on work, like I or other trainees have mentioned. You're also going to be working in an organization, so you're going to work in a professional setting. You're also going to learn a lot because you have a limited work experience, so I'm sure you're going to learn all the things like a sponge. You'll also get a lot of support, not only from your line manager, but you're also going to get support from Sophie or any other people in this department. They're all very friendly and welcoming. You also have a mentor. I have a mentor for my career aspect, but obviously you can talk to mentor about anything, including like mental health or anything that you have in mind or any problems that you're facing. Also, you're going to meet a lot of people with a lot of backgrounds, so you can have a lot of opportunities to network and know more about people. Next slide, please.
Friday, you're on mute.
So application advice. Answer every single question. Sophie and a couple of other people are going to read each and every application. Please just make it personal, show a bit of your personal flair. Everyone appreciates that little bit of a twist. Provide some evidence, again, using what Clarissa was saying. The star paragraph is really good at answering questions. Use all the space. Please don't be afraid of saying too much. It's better to say too much than too less. Don't be put off if you don't feel qualified. I definitely would say a lot of people, say for example, Kaide, she wasn't exactly in cybersecurity, but she's learning, and this is what this traineeship is about. It's about giving that opportunity to people who are trying to start a career, that experience. And the best thing I'd probably say is the application process, because it doesn't entail a CV. You're probably going to find it a lot easier than typical job applications. So please just put a bit of time in, don't stress too much. And if you do have sort of anxiety or any sort of performance related issues, please do talk to Sophie about it. They're very, very supportive. When I did my interview, for example, they gave me extra time and that sort of thing. So please just be honest and consult advice from Sophie.
So now going on to more specific advice if you feel stuck on your application. So as Clarissa said earlier, make sure to draw on all of your past experiences. There's always something that you can draw out of skills or attitudes that you demonstrated during that role. Also, brainstorm the links between the opportunities to show a certain passion in the field, in the topic, in the methodology. Make sure you can connect why you've been pursuing those and how it links to this new opportunity. Also, showcase the skills that you already have. Soft skills, being able to communicate, writing skills are also important in every role. So don't feel that you have nothing to write on the application. Also, clearly describe the skills you want to build specifically. As Clarissa said, look at the job description, which things will help you in your career or that you want to learn, and make sure you mention those. And also just be honest about your level of experience, because as Angel said, this is a learning experience. They don't expect you to know everything, and you don't have to know everything. You're here to learn, and there's people that are going to support you to learn. So don't be put off by that either. And now I'll pass back to Sophie.
Thank you. We're sharing offices today, so it's quite difficult not to get echoes. Well, thank you so much, everyone. I've gotten a lot of questions in the Q&A about specific eligibility criteria. Please, first of all, check our website where it's outlined specifically. If you're still struggling, feel free to send me an email. But please don't leave it to the last minute, because I don't read my emails in the weekend. Yeah, like, please don't leave it to the last minute. We also had one question in the Q&A for Amish. if I don't have any experience in SPSS or R, can I still apply for the cancer screening program?
Yep, you can. We will support you with any data analysis stuff that you need to do anyway, so that's fine. I would still apply.
Okay, great. I have another question for you, Amish. In regards with the cancer screening role, are there any preclusions for people who have had cancer in the past or carry a BRCA mutation?
So are there any what, sorry?
So are there any preclusions for people who have had cancer in the past or carry a BRCA mutation?
No, not at all. It's anyone who is interested in the project, and if you're interested because you've got a personal history in this area, then I would definitely employ you to apply, to be honest with you. A lot of the people that we work with, they have our PPI partners have personal experience with these cancers, and you Amazon. So I'll definitely get you to apply.
Thanks. We also had a question. Once you complete a 12 weeks period of the program, will you be able to sign for a permanent job contract within the same project, or would that be the next step? This will be a training program for 12 weeks. So probably there will not be a permanent job contract, but there might always be opportunities that open up during your time with us. You'll also have access to lots of internal positions at Imperial. So hopefully that will help you as well. Would you be able to have references following the end of the program? Yes, definitely. You will get a certificate that you did your time with us. And we will definitely, you will have a line manager, so they are always happy to give references at the end of the program as well. Sorry, I didn't say that. So both projects take place at St. Mary's Hospital in Paddington. So we currently trial hybrid working, which means we are in the office 3 days a week and we work from home 2 days a week. So you will be based in St. Mary's Hospital in Paddington, which is London, and you will be expected to come in 3 days. Usually this is in agreement with your line manager so that you can come in on days where you can be together. So I have one more question. If I am a student who is required to be in the lecture theatre Monday to Friday, is it possible to work remotely, come into the office part-time? So we can discuss arrangements, but we would hope that you can come in 3 days a week, because we just want you to have like the full experience. There's a lot of networking that you can do. There's a lot of meetings to attend. So just be mindful if you want to have the good work experience. If you can combine the two, it would be best if you can come in at least 3 days a week.
And can I just add to that, please? Just bear in mind as well that because training posts come up twice a year, it might be that it's more appropriate for you to wait for the next cohort and apply then. Because like Sophie said, this is supposed to be, we only have one post or one trainee per post that we're advertising. So we have to decide as well who would get the most out of the experience. And of course, you know, we can make reasonable adjustments, but please do consider that maybe another future opportunity would be better for you, and it might be best for someone else who has the capacity to fully engage with the program and get all the benefits from it to be in that training position. Yeah.
Thank you. Yeah, that's really helpful. So I think we've answered most questions. So as I said, if you have any more questions regarding the program, feel free to send us an email. And also, so we have recorded this. It will take some time because we will add subtitles, but then we will share the recording so you can rewatch it if you need it for your application. We have also linked in the chat, Clarissa has sent the link to the program website where you can review all the criteria. Please also, you know, review the job description very carefully, because that will help you as well. And I had another question in the chat. Would you be able to assist to find a similar internal job following the end of the program in Imperial? So you will have when you're employed as a staff member, so you will have access to all the jobs at Imperial. And if there are any jobs that come up during your time with us, you know, you're more than happy you're more than welcome to apply for those roles. So yeah, the slides will be shared with the recording as well, so you will definitely receive them. Probably not tomorrow, but I'm hoping the end of this week, early next week, so don't quote me on it. But it will be as soon as possible, and it will also be added onto our website, so you can review it there as well. And yeah, I just want to say, like, thank you to everyone, to our trainees. And sorry, I got another question, the salary. So the salary is listed on the job applications, on the job description, sorry, at the website. I don't know it from the top of my head, but it is definitely marked on the job description. If you just look at the job, it will be marked there. And thank you everyone for joining, and we really look forward to receive your applications. You know, it's an anonymous application, so everyone has the same chance. Just do your best, and we really look forward to meeting you soon, hopefully. Thank you very much.
Angel, do you want to say something?
Just to add on the question for the salary. So I don't actually live in London, and the salary was enough for me to move down to London to do this placement here. So please do not worry about sort of the salary, if it's going to be enough to afford a London accommodation, etc., because it is above sort of the living wage, and it's extremely well paid for the fact that we're taking no experience and learning so much from this. So please do apply. Thank you, Clarissa and Sophie, for figuring funding out.
Thank you very much, everyone. Enjoy your evening.